Hello, everyone, and welcome to the TRT and Hormone Optimization YouTube channel. Dr. Eric Serrano, Postpartum Depression.
Welcome to this channel. I am Dr. Steven de Vos, the lifting dermatologist, and this is my bro science hunting partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe.
Click the bell button to get notified.
I also invite you to join my other YouTube channel, The Lifting Dermatologist. The link you can find in the description of this video.
Hello, everyone, and welcome to the TRT and Hormone Optimization YouTube channel. My name is Danny Bossa. I'm joined today with the incomparable, the savant, the all-knowing, the all-wise, Dr. Eric Serrano. How are you, Eric?
Very good, sir. Nice to see you, sir.
Good. So, topic today. My wife happens to be in several moms type of groups, and there appears to be a ton of women that are going through some crazy postpartum depression. She went through it herself. I'll give you a little brief description. You're aware of it, but just for everybody watching, what she went through. And she's just seeing it to be very, very common. And a lot of them have no idea what they should be doing. They don't even know what it is. They can't even recognize what it is. All they know is they don't feel well. So just to give you a kind of a brief explanation, my wife went through a pretty difficult pregnancy, but she kept her wits about her, and her mood was as good as it could be. And then she gave birth, and everything was okay for a little while. She had to get induced during when she was in labor, and they had to give her a ton of oxytocin, as you're aware. By the way, guys, I don't know if you know this, but Eric was actually calling me like every 10 minutes while my wife was in labor, which is pretty cool, telling me barking orders to tell the doctor to do this, to tell the doctor to do that. It's pretty funny. And he warned me that in about 6 weeks' time, due to the amount of oxytocin she was taking, in about 6 weeks' time, I might notice some changes in mood, depression, insomnia, anxiety, all kinds of stuff. And literally, almost to the day of what he told me was going to occurred. And I could tell you, it wasn't pretty. Women are already very emotional beings compared to men. Men are a little bit more logical, rational. Women, they think more with their emotions. Any shred of rational, logical, critical thinking was completely gone. You could not reason with her. She was in another state of mind entirely, and it didn't matter. She would say, but I'm feeling this, and you would try to reason with her, and it was pointless. You'd be having a conversation where she'd just bust out crying. She would want to spend 2 days in bed. She couldn't get out of bed, crying uncontrollably, and you couldn't even talk to her. It was like talking to almost a crazy person type thing. And I couldn't believe how she went just from a couple of weeks prior into this state. And I was calling Eric often saying, I don't know what to do. I don't know what to do. And he's like, I warned you. I told you this is going to happen. This is what you got to do. And the second that she started doing the stuff that Eric had suggested, I can tell you there was a massive improvement. For what we're seeing, and especially what my wife is seeing in these groups, a lot of these women don't have a clue about this stuff. And I would really like Eric to share his wisdom and his knowledge. He was an OBGYN for like 9 years. So he worked with a lot of pregnant women before and after. So Eric, I'm gonna leave this to you, and you can share what happened with us. You recall and
Okay.
what was done and why.
First of all, I wasn't OBGYN. I was a family practice that was trained to do OBGYN. We did deliveries. I was in charge of the ultrasound at the facility we were. So I taught ultrasounds also. I did deliveries up to the point that in 1 month, I delivered 72 babies. It was crazy. I love it. I was a typical OBGYN. I induced patients. I didn't want to wait until the weekend, so I didn't have the weekend to deliver the babies. So sometimes I would induce women just to get them induced, because I didn't want to wait for the weekend. And as I got older, I started dealing with the depression, of course. And we live in a very liable society here. If you're not careful, they sue you, correct? And if the person gets depressed here, you have to send them to the psychiatrist to deal with them. Well, I was having some findings of people that were getting depressed. And of course, I have to do the right thing. I said, okay, I'm going to send you to a psychiatrist so they can deal with it. But then the psychiatrist would say, oh, I put your SSRIs. I put you on antidepressants. Well, first of all, they didn't work, number one. Number two, they worked, it worked for a short amount of time. And it was dependent in so many things that I started writing down every detail. And I was a typical doctor, I said, okay, SSRIs, SSRIs. And then I started thinking, okay, I'm a smart guy. Let me think about what I'm doing. And the last 2 years of my practice, I started dealing with diets very strongly. If you didn't want to follow my diet, I didn't want to see you as a patient. I didn't want to see you because then you get complications. And I know you didn't tell this to the viewers, but Angie Sugars, she was diabetic. Remember that? You forgot to tell them that detail.
Yeah. She
And
was diabetic during the pregnancy. She was not diabetic before.
gestational diabetes is called.
Correct.
And Danny come and say, Eric, this is crazy. My wife sugars. Remember you told me 160, 180s? What do we do? And I changed her diet. And I said, you're going to do this. And then when you went to the doctor, remember what the doctor told you? You're wrong. You don't do that. But her sugars were perfect, weren't they? So it was funny. Oh, don't do that. You're wrong. But then Angie tell you, I feel great. What are you talking about? And you call me back and I said, listen, say yes to what they're telling you, and then get out of there and do what I asked you to do. And I will talk about this in a second. I want to explain a lot of things. When a woman is pregnant now, because we're scared of being sued, doctors will take you in and say, oh, you need to have deliver this baby. Now, to deliver the baby or to induce the person, we use something called oxytocin, or in the hospital it's known as pitocin, Pitocin. And when they do that, they give it to you IV to induce contractions of your uterus. And this hormone is actually, and this is what made me really truly think about what I was doing. This hormone makes you almost like feel better. It makes you almost enjoy that delivery. Okay. And I said, well, when I hug you, or you hug your dog, or your son hugs you, or your daughter hugs you, you release oxytocin. And I'm thinking, wait a second, this is the happy hormone, or the love hormone, and we're giving you massive amounts, and then all of a sudden you cut off. You don't have nothing. It says, you're done. You delivered the baby, we're great, go home. And I was guilty of that. And then I started saying, okay, I'm gonna compare my non-induced patients with my induced patients, and I want to see what happens. And I started taking notes. Out of 300, the last 300 that I delivered, about 80% were not induced, and the 20% were induced. And I noticed that my induced ones had more, I would say, symptoms of depression when you ask them correctly. And remember, I predicted 6 weeks because that's when it all started. I said, we're going to keep details of what you're doing. We're going to find out if you have like crying spells, or you don't feel like you're loved, or you don't love your child. And by the way, I want to make a little simple description here, because women worry about this. Women say, I'm crazy. I don't feel like I love my child. That's how bad this is. Or I feel like I don't love this child. I feel like I don't care about this child. I don't love my husband anymore. Those are symptoms that happen through the postpartum depression. I mean, it's crazy. You describe it very well, Danny, how they cry. They're talking to you. They don't want to even be there with you. They say, I don't want to be with you. It's crazy. I don't want this child. And those are all symptoms of hormones. And now, oxytocin is a huge deal because it's the love hormone. Here you are high levels, and all of a sudden they're gone. So now we have one issue, low oxytocin. Two, the woman delivers that baby, progesterone levels go away because we not only induced it, the body was not ready, and we do that. And we said, okay, you don't worry about it. One thing that most doctors do not know is that pregnancy is a hyperthyroid state. The body will make more thyroid during pregnancy. Why? Because the child needs it too. So the TSH goes down because the thyroid output goes up. But also there's something called melanocorticotropin releasing hormone, in which when your wife got pregnant, her nipples changed colors, right? They got darker. And the reason is because this hormone is melatonin, makes you darker, right? So it makes the skin darker. And that actually acts like a TSH, induces output of thyroid. So here we are, we have this woman that is pregnant. Now all of a sudden we abruptly delivered this baby. Now we're left with low progesterone levels, maybe a change on thyroid, maybe not a change on thyroid, and all these hormones going crazy. So now you have a basket that is crazy there that is going to explode. Now I start saying, well, I'm going to do the SSRIs. Well, SSRIs, there was, I would say 10% of the people that responded to the SSRIs. They say, I feel better, I feel great. But I also know that progesterone increases serotonin receptors in the body. So I'm thinking, well, what's going on? You know, are we overcoming that serotonin levels? Are we giving them? What happens if I do something else? So I decided to do this. I will ask my patients. I said, how do you feel? So I would see my patients every 2 weeks after the pregnancy because I wanted to make sure, and I would do that for 2 months. If after 2 months they didn't have no postpartum depression, I know that we're going to happen. So I said by week 6, they start having symptoms. By week 5, and I said, okay, I'm going to start you on progesterone. I start checking. I wasn't even checking the levels. I just start putting them on progesterone, on bioidentical progesterone, by the way, no Provera, no fake progesterone, just bioidentical progesterone. And I start checking their thyroid levels. And it's funny because on most of them, the TSH was always low end, always low end. So you go, I don't want to treat them with thyroid. But the T4, free T4, and free T3 were low on the borderline. So I'm thinking, wait a second. Here is a person that the TSH is not what I wanted, but also the T4 and T3 are also low. What's going on? He said because the baby was making thyroid. He said because the baby also, by the way, the baby makes DHEA, and people don't know that either. Nobody knows that. So the baby makes DHEA. 2 weeks after the baby's born, the adrenal glands regress, and he doesn't make it anymore. People don't know that. I just want you to know that, Danny. So here is a person now that has low thyroid, has low progesterone, serotonin levels might be disrupted or not there, and they have high levels of oxytocin, the love hormone. And if you think about it, when the woman is crying, when the woman doesn't want to touch you, there's no touch, there's no love, there's no feeling of anything, so the oxytocin doesn't go up. So here we have even bigger issues because to correct it, that woman say, hey, I want to hug you. I know I don't feel like it, but hugging helps. Or let me hold the baby with the husband around, by the way, because I have patients that were so crazy that they want to drop the baby off, you know? So I say, no, we need to make sure that you're with the husband 24 hours a day. Now, what do I do? And I did this with Danny's wife. I said, Danny, we need to start on progesterone. We're going to start on progesterone. We're going to start on low-dose thyroid. Now, depending on what was happening before, and I want to say this, in the case of Angie, she had gestational diabetes. By the way, if you have gestational diabetes, you have an 89% of having diabetes later. Okay, so be aware of that. So tell Angie that if she doesn't watch the starches, there's still a high chance of getting diabetes. So I decided to start doing this. Let's do what I call the 10-minute hugs. So I will tell my patients, you're going to hug your husband for 10 minutes. Doesn't matter what you're doing or a dog. I said, you need to sit down with your dog, hug your dog. Why? Because that releases oxytocin. I'm going to start using bioidentical progesterone. And in this case, I use 200 milligrams. Why 200 milligrams? Because I tried 50, I tried 100, I failed. I said 200 is when it started working. Now, if the patient is a little bigger, they might need 400. But I started 200, and within a week, you see results. And you saw it, Danny.
Yeah,
now,
absolutely.
I started 200. I started low-dose thyroid. I use different thyroids. It depends on the patient, but I will use natural thyroid, Armour thyroid, MP thyroid, whatever. In your case, we don't have access to it, so we got to use T4 and T3. Yes, I use both because I want to help that patient. You will get results within 2 weeks. You see a change on that person. I know I'm making this up. I mean, Danny can testify about that. And it's funny that we're talking about this, and I have a paper to send you. I read all the time. I read weird journals. And the new, this SSRIs, this SNRIs, atypical antidepressants. Now, this one called SAGE 547, SAGE 547. You can read about it. I know nobody knows about this, but this is called allopregnanolone depression derivative hormone. This is awesome. Okay, if I take progesterone on my skin, like some practitioners prescribe progesterone on the cream, yes, the body will absorb it. I had never seen it doing well with it, but I have seen people that are anxious that use the progesterone cream and it responds. But when it comes to depression, it must be oral, cannot be cream. And the reason is when you take the progesterone goes absorbed by the liver changes to something called allopregnanolone. And that is a super powerful hormone that works as an antidepressant. So now, of course, the pharmaceutical companies know this. They knew this for years. Oh, we're going to come with a new drug, SAGE 547. And it's already on phase 3. And this works within a week. They have depressed women. They use it on women right now only, that they give this pill, and within a week, they're back. They're not depressed anymore. It works instantly. Actually, the reports say even within 24 hours. That's what is freaking cool. And I will send you the paper, which is incredible. So why are they doing this? Because they knew that if I give them one progesterone, changes to allopregnanolone, now, of course, you cannot charge for a non-synthetic or a natural product, so you have to make it synthetically, and that's why it's called Sage 547. And it's kind of funny because in this paper, they say, hey, we have results within 24 hours. And that's why exactly what happened. That's why when I saw at 200, it's because I tried the 50, the 100, and I didn't see any. Can you measure allopregnanolone? Yes, we should be measuring allopregnanolone in women. Although I have not done it, I think we should start doing it because I think we'll say, hey, we might be able to predict a depression on this patient by measuring those levels. Although that's a statement, I am making that up. That's a Serrano theory. It hasn't been proven. I just want to say that.
Two questions really quick. Was the progesterone you do with your clients, is they always oral? Like I know in the case of my wife, she was given Prometrium and it was a capsule, and they said you can actually do it intravaginally, or you can do it orally. She was doing it intravaginally, and it appeared to work well.
Yes, that's funny that you say that. I didn't want to say intravaginal. I know she used intravaginal because you told me still it will go then the liver because the vagina has such high absorption that it will get on the blood. Progesterone levels go up first, but then eventually hits the liver. But because it's the vagina, there's no intestinal issues. You don't have to worry about probiotics. You don't have to worry about parasites. You don't have to worry about anything else. So yes, they did the correct thing. Now the vagina will absorb high levels of progesterone instantly. It's really a way to have high peaks. Some women don't want to do it because they feel uncomfortable. Now, you talk about Prometrium. Yes, let me discuss Prometrium a little bit. Prometrium is a micronized progesterone, means very, very particulate or very small, so it's easily absorbed. Now, in the United States, they have micronized progesterone that is not Prometrium and it's made in China. What happened to me was I was using Prometrium and the levels of my females were perfect. When they go back and they change the prescription to generic progesterone is cheaper, it's the same. Let me try that one. I went crazy. I had to call Neil and I said, Neil, what is this crap? I'm having levels of progesterone that are not even close to what I was getting. I have to go up to 600, 800. And he said, Harry, go find out what they're taking. And when I call the pharmacy, oh, we're getting micronized progesterone. I said, from where? From China. It is not the same. 200 milligrams of Prometrium are 600 milligrams of generic progesterone, whatever you're getting. So Prometrium is a brand name which actually absolutely works. Now, I don't use Prometrium in two instances. One is if you're allergic to peanuts, because the Prometrium is in peanut oil, okay? So I have to be careful. If you have an allergy to peanut, I don't use it. Two, there's some women that the capsules are different colors, green, pink, whatever it's going to be, depending where you are. And some people have issue with the dye. So I go, okay, I'm going to call the compounding pharmacy. I want micronized. And when I put micronized, I put micronized progesterone USP. And I'm saying USP because I'm using the United States pharmacopoeia, making sure that that's what I want to use. And it's totally different. If you use generic progesterone, you can have 4 Prometrium. Then your dosage has to be 400, 600. I don't know what the dosages will be with generic, but you need to go ahead very high. If you use generic progesterone intravaginally, you still have to use a little higher than normal. I just want to tell you that, guys. So be aware of that. The thyroid.
So Prometrium is not available. Is there other brands or other types of progesterone
You need to
work?
call it compounding pharmacy. You need to call it, and it has to be written micronized USP and 200. Now, if it's the generic, then you need to start at 400 to 600. I don't know what the starting dose will be because it depends on which generic you're using. And the best way to find out is call the pharmacy and say, hey, where does this come from? Is it real? What is it? And that's why you have to make the decision of doing that. Thyroid, it depends where you have thyroid, what access do you have to. I use T4, T3, I use MP thyroid, Armour thyroid, wet thyroid, nature thyroid, whatever my patient can afford at the time, I will do it. Now, if I'm going to use T4, I will use T3. Very small dosages, 5 micrograms, you don't need 25, 50 micrograms. I know that I have people saying, well, Serrano told me to take 50 micrograms. I never said that. The dosage of T3 is very small. Sometimes I even compound it, Danny, to the point that I only use 1.5 micrograms because that's how little I need. I just need that mother to come back from the wear. okay? And that's basically the system that I use. Of course, every woman is different. Now, if you have diabetes before pregnancy and you have gestational diabetes, then you need to make sure that you stay away from starches because you know you're going to get depressed. The sugar is going up and down, and that will also affect you. Now, I have women in my practice that, of course, I check levels. I was looking for stuff, and I check the zinc, copper, B12 levels, and sometimes you need to correct the micronutrients, but that woman will come back. In my practice, the last 2 years, I was very successful in lowering what I call postpartum depression side effects. I would say of the women that complain, let's say 20% of those women, I was successful 99% of the time cutting it off. So
Just doing that.
yes,
Well, you mentioned earlier allopregnanolone. It's my understanding that pregnenolone itself converts into allopregnanolone, correct?
that is great.
So can pregnenolone supplementation on its own assist in raising those levels?
No. Well, wait a second, Danny. That is a great question. I don't know the answer to that.
Okay.
So I don't want to tell you something that I have not done. I know that a lot of practitioners use pregnenolone, but I had not used it for that purpose. At that moment on time, I assumed that the woman was on progesterone, you know, and I needed to make sure that they needed that progesterone. So that's what I did. I do not know. I don't know, Danny. That's a great question. So I do not know how much that will go into the allopregnanolone. I don't have the answer for that, Danny. That's it.
Okay.
I mean, that's something I have to look up. I need to think. Now I'm gonna have to go look on the damn books. Here we go again. Talking to
Thanks.
Danny. I didn't think about that. I'm a doctor. You know, I would like to have that answer. I don't know. You know, because we concentrate so much on progesterone. Hormone. I don't have the answer. I don't have the answer. And actually, I want to say this: progesterone is made more in your adrenal glands than your ovaries, except in pregnancy. In pregnancy, it's made more in your ovaries. The corpus luteum makes a lot of progesterone, which is crazy. And then, of course, it goes away. But progesterone comes from the adrenal glands. So I wish, man, Danny, now I'm going to have to go hit the books. I don't know the answer. I might have the answer later, but right now, I have no idea. I can't tell you that.
Okay. I didn't mean to take up the rest of your weekend with research now for
I'm going to, you know,
for
I'm
what
going
I thought was an amateur question.
No, that was a great question. That was a doctor's question, and I don't have the answer.
Okay. So for thyroid, okay, so for progesterone, you're pretty much stating that 200 milligrams is kind of your standard starting dose, or was your standard starting dose. So in regards to thyroid, so if someone has access to T3, T4, was there a standard to say, I'm going to start at that and I'll see where you go? Or was it really based on where their levels were at the time?
You're going to find this funny. If I was going to use Centro or levothyroxine, I start at 50 micrograms, always. And let me explain to you why. Not because it was the right dose, not because it's the only dose. It's because the only dose that doesn't have dyes is thyroid, it's pure thyroid. And I picked that one because I said, oh, this one doesn't have dyes. This doesn't have any additive. Let me use the 50 microns because I don't want to affect the baby. You know, I don't want to affect anything. So I started with 50 microns. Now, the T3 came by accident. We can only get 5, 25, and 50 on the state. Of course, me being a dumbass, I'm going to start at 25. You know, and I seen that high levels of thyroid have a drying effect on the breast milk. And I might be wrong, this might be accident, but I think that me giving 25 micrograms, well, let me take this back a little bit. When you're depressed, you don't want to breastfeed. You know what I'm saying? Danny, you don't want to, you breastfeeding first, but then you don't want the baby touching you, you don't want to breastfeed. So then I started on high dose, and I said, well, you know, my milk doesn't come out like it used to. He said, because they stopped it because they were depressed, or he said, because I started that high dose. You know, I don't know the answer to that one. Two, so I decided to go to 5 micrograms. And then when I was doing 5 micrograms, 2.5 in the morning, 2.5 in the afternoon, there was no I'm back eating, I'm okay. So I think that high levels of thyroid might also do something with that. I don't know the answer to that either, but you don't need that high dose. In some cases, I remember a couple of cases that I had to go to 15 and 50 micrograms of Cytomel or T3, pure T3, because a woman needed it. They'll come back and say, you know what, Eric, I feel better. I don't think I'm going to kill myself, but I'm still depressed. So, hey, let me titrate her up, and then we titrate her off later. And that's why.
Gotcha.
That's how I came with those dosages. On the natural thyroid, I always start with 60 milligrams, or 60 is 1 grain for people that want to know. And then I will go up or down depending what I was doing.
Okay. So we've kind of discussed now the progesterone side of things, the thyroid side of things, so we can discuss the diet side of things. And I'll tell you guys really brief what Eric told Angie to do. So Angie was, she was at risk for diabetes because her mom had diabetes and there's other people in her family had diabetes. So she was always kind of borderline, you know, could go one way, go another. But she always ate well and she exercised, and that was never really an issue up until she got pregnant. During her pregnancy, she developed
Gestational diabetes.
gestational diabetes. Thanks. My espresso is wearing off, as you can see. Gestational diabetes. So she had to take insulin, and she never injected insulin before, and she never really injected anything, and she had to get used to that. And then she was tracking what type of foods she was eating and what her sugars were at after, you know, a certain dose. So she had to track, you know, okay, well, now I had this and it was this much insulin and now my sugars are here. So it's more, I'm going to try a little bit more insulin. And it was constantly trying to adjust the food and adjust the insulin. And, you know, she would have like a half an apple and forget it. Her sugars were completely through the roof, no matter how much insulin she took.
Say that she was following what the registered dietitian was telling her to do, though.
Correct. So the dietitian basically said, you know, you want to maybe avoid these types of foods, you know, but you could still have a little bit of fruit in moderation, just like that. Just don't eat anything with too much sugar. Stay away from the desserts. Stay away from whatever. Then after speaking with Eric, he's like, get her on keto. So she's like, okay. He says, just get her on keto. She gets into the ketogenic diet. She was strict as hell. She had all her meals kind of lined up and planned. We both did it together. And she was just realizing, like, I didn't need anywhere near as much insulin as I did yesterday. And it was less and less and less, to the point that she says, I haven't had any insulin in 3 days. I said, wow. She goes, yeah. She goes, I'm just controlling it with diets. I call Eric. I'm like, dude, like, she's not, no insulin required at all. This is amazing. He's like, dude, what did I tell you, man? I've been doing this a long time. That's my worst Eric Serrano accident. But we ended up having an appointment at the hospital where she was being followed. And they started saying, you know, where are your charts of how much insulin? And she's like, well, I'm not taking an insulin. And the girl's like, well, what are you doing? What are you eating? And she's like, well, you know, I have my meat, and then I have some vegetables, and yes, I had some fish, I had some chicken, more vegetables, I'm eating this. And the girl's like, well, where's your carbs? Where's your pastas? Where's your fruit? And she's, oh no, I'm not taking that. She says, I'm controlling my sugars with diet. And the girl's like, oh no. You have to have you have to have the carbs. The baby needs the carbs. If you cut out the carbs, the baby's going to be harmed. So, you know, get on the carbs and take that insulin and make sure the baby has everything. And I'm just looking at her, and I'm texting Eric in the interview.
I know.
And and I'm like, dude, I'm with someone right now that I just want to slap. And he couldn't believe that she was saying
I was in shock. I said, hell with that shit. Don't do it.
And I'm like, well, we're good. She feels better now than she ever has before. Doesn't need any insulin. And she kept insisting, you're going to be damaging the baby. You're going to be preventing this and this and this with the baby. Your baby's going to have issues. You have to have the carbs, and you got to take that insulin. And then my wife's like, yeah, okay. We left her like, what the hell? So, and she just controlled it with diet the rest of the time. Even at the birth, that same doctor came in to check, and Angie confirmed again. She goes, sorry, I didn't listen to you. I kept it in controlled diet. Baby was born. Baby was perfect. The woman is, you know, in shock that everything worked out well. So I don't know if they're just behind with this stuff or what, but I'm really happy I listened to you on that one. So maybe you can give some details.
Well, you know, I did it for so long. I screw up I was the one that telling you need high carbohydrates. But, okay, they tell you to take more insulin as you take carbohydrates. Well, wait a second. What happens when you take insulin? What happens to that baby? The baby gets bigger. Hyperinsulinemia causes you to gain size. The mom gets fat and the baby gets bigger. What happens when the baby gets bigger? It doesn't fit through the hole, which makes you do what? A C-section. Absolutely so wrong. And it's kind of funny. And the reason this happens is, you know why they tell you that? That is because the baby will hypoglycemic. Or if you don't give her carbohydrates, the baby is going to go hypoglycemic. That's the fear. Of course the baby is going to go hypoglycemic because you're freaking giving them insulin, you moron. Let's think about this. If the mother requires less insulin, that means that the baby is getting the food that he needs. So I had massive fights about this in a teaching institution because I will tell them, hey, you need to cut the carbohydrates. No. Preeclampsia or high blood pressure, urination, this issue what happens with preeclampsia, with hypertension, elevated protein in the urine, and what happened to her, it's crazy that happens to women because in my practice on the last 2 years, I didn't have one single case because I changed their diets. And I followed their sugars like a robot. I was Hitler. So you need to check your sugar 3 times a day. You need to make sure that you tell me, take pictures. And luckily, by then, now we have phones. So I would tell my patients, take pictures of what you're eating so you couldn't lie. So if you didn't bring me pictures, I didn't want to talk to you. If you don't have the pictures of the food, you need to bring them to me so I can look myself. Even if you cheat, you take that picture. And, I was lucky, that my patients really like me a lot and they love me actually. And my patient, I did this. And I remember my patient, oh, Eric, I had ice cream. Damn it. And there's a picture of a huge ice cream, Sunday. But then my sugars were only 110. It used to be 160, 180. I said, that means you're getting better. I also, because Danny, I did ultrasounds, I followed the size of that baby, okay? And I was making sure that they didn't get the head too big, the size were not getting. And it's kind of funny because in the institution where I was working, if you were a gestational diabetic, you have to see the dietitian. And I follow my patients and I follow their patients. And my patients never ever have big size. Their patients have massive size. I'm talking about 11 and a half, 12 pounds babies, which are crazy. Mine were normal, 7, 8 pounds, normal delivery. It is absolutely insane. How don't we think? If I give you carbohydrates and I give you insulin, the carbohydrates are going to come down from your blood. Then I'm going to give it to the baby. So of course the baby is going to go into hypoglycemia, and you have to give the baby sugars. No, it's a lie. I like to read history, and I want you to think about this, Danny. When we were before Egypt, there was no agriculture, right? Where in the hell do you think the women were eating? They were not eating freaking broccoli. They were not eating starches. There was no wheat. There was nothing like that. Either milk, eggs, or things that they hunt. That's the only thing they can eat. There was no freaking corn waiting. Corn takes years to grow. Rice takes years to grow. All these things take years to grow. The baby lasts 9 months. No freaking way you were able to survive if you didn't eat meat, if you didn't eat nuts on the floor, or found the forest, or roots. There were roots that you would eat. So the stuff about having carbohydrates during pregnancy is a fallacy. It's a freaking lie. I would say 80% of my pregnancies, I completely almost avoid them. I let them have fruits. I let them have vegetables. I let them have nuts. I let them have dairy. But I rarely let them have sweets all the time. I even cut it to twice a week. And I never had one single issue with my patient. So amazing. Absolutely. And now you are an expert on this, Danny, because people don't know this. Danny's in the hospital, which is why he's texting me every 2 seconds. She said this now, and then I'll go back. I don't care what she said. Don't do that. And Danny would text me. Now she's saying that the baby's going to die or we're going to have issues. I said, Danny, remember that, Danny? I said, yes. Leave her. Don't do. And I said, just ask you how she feels. What are the sugars? And I asked you to ask you, well, her sugars are normal. What do you want me to do? And they told you eat more carbs. Of course, if you eat more carbs, you need more insulin.
And I'm like this in the room saying, I'm sorry, we can't. And she's like, why? I said, because he's telling me that. And she's like, who? I'm like, Eric Serrano. Who the hell's Eric Serrano? I said, it's Eric Serrano. If he tells me to do something, I do it. And that's it. So that's what we're doing.
I also remember I said, say yes, that you're going to do everything they say. Remember? I said, don't say anything. Just tell them, yes, you're correct. We were wrong. We're going to do it and get the hell out of there. And then it's kind of funny because I want to tell you guys, Angie started texting me with her food. Angie started texting me her menu. Angie started sending me pictures. She was a machine. She was, how would I call Angie? A robot.
She was a machine.
She was a machine, man. She was like, I would laugh and say, excuse me, Angie, I want to eat like you're eating. This is amazing. And she would have the food prepared. And she would tell me at the end, I want my baby to be good. I want to feel good. I have to do what I have to do. There's no questions about this. And here is a person that is funny because now she's postpartum depression, but before this, she's willing to sacrifice herself to be able to have a normal pregnancy without any condition or issues. She was a total machine. It was amazing. Amazing.
Well, she's Irish, right? I'm Italian. I thought I was stubborn. She's way more stubborn than me. Here. You can see. He's got he's got a little helmet on because he had a flat head for a little while. So the helmet's gonna fix it up and make his head totally round. But trust me, he's growing like a weed. He's super healthy, and the diet and not taking insulin.
Angie was breastfeeding and everything. She was perfect.
You want to hold it?
Here, if you want to just say really quick to the women watching this.
Angie, what was your experience? Remember when I was telling you in the hospital, don't listen to her, but just tell them that you're going to do what they say. Just say, yes, I'm going to take my insulin. Yes, I'm going to eat carbohydrates.
Yeah. Actually, one of the nurses looked at my numbers, and I heard her telling another nurse, she's like, her numbers are beautiful. I haven't seen numbers that have been controlled so well with diet. And then I had this dietitian saying, but you have to eat carbs for the baby to be healthy. And I was just, okay, like, I'm just going to nod my head and not say anything, and just, because I don't want to argue. There's no point to argue, and I'm just going to do what I'm going to do. And it was just being controlled perfectly. At the end, it didn't matter what I ate. I could never take enough insulin. Like, it wasn't being controlled.
I know, but they don't understand that. And you feel better, you're doing better, but you need to take insulin. I don't understand that. And, remember I asked you, how are you feeling, Ancha? You feeling good? I said, I feel great. I feel better than before. I said, hell with them. Don't pay attention to them. Do what you need to do. Here is a person, and Anya was telling me that you were my perfect patient, even though I wasn't seeing you. You were a machine. I call you the robot, because you start sending me your menus. You start sending me what you were eating, pictures. Eric, I ate this today. Remember, I would say, no, don't eat that one.
Sorry.
What?
Tell them really quick what you felt like when you started, when you got on the thyroid and the progesterone.
Oh yeah, tell them what happened. Tell them when you went to the doctor. Tell them all that.
So going through postpartum depression, it's like you're not sleeping. First of all, you have to take care of somebody else when you're not healed yourself. And I think the most part for me was the anxiety that I wasn't doing well enough, that I couldn't take care of him, that I couldn't, but at the end you realize that the person that your baby needs is you, and you have to be well to take care of them. And when I started taking the thyroid, it took about, I'd say, a month, but like the progesterone was fairly quick. But when I started taking the thyroid at a month, I felt like the sun came out. Like it's in Montreal, we have these horrible winters, and then spring comes and you can take off your winter jacket and you can just it's summer, it's like nice weather. So that's exactly what it felt for me taking the thyroid medications. Like all of a sudden the sun came out. So
Angie, so they know what you were taking. First of all, I want you to tell them what progesterone, which type of progesterone, how were you taking it? Tell them which thyroid were you taking exactly. Can you explain that?
Okay, so I was taking Prometrium.
How would you take it?
I was taking it as a vaginal suppository.
Okay.
And I was taking 200 milligrams before bed each night. With the baby and getting up and doing night feeds, I decided to switch it and take 100 milligrams in the morning and 100 milligrams at night, just because I wasn't so sleepy at night to wake up. And the thyroid medication I was taking, was it 25 milligrams? I'm not sure. One tablet in the morning and one in the evening.
The T3,
T4 mix. Yeah. And that took about 3 weeks to a month before I noticed the difference in that.
I want to say this. I started Ange on a low dose because she wasn't being really my patient, so I didn't know where to start her. Usually, I would think she would have got better results even quicker if I would have started a higher dose, but Angie's in shape, actually. If you guys see pictures of her, I'm jealous because he's married to an old guy, I don't know what to do. But here she's in great shape, and here's a woman that, like, she explained to you guys how much she wanted that baby to be better. I need to get better myself. And actually, Angie wasn't being totally honest. I had a conversation with Angie one time, and she was crying on the phone. She was telling me how she was feeling. And I said, Angie, you're going to feel better. So I had the progesterone. By the way, did the OBGYN give you help about giving you the prescription for the progesterone? Or how was that? Was it easy to get it, or how was it?
It's very hard to get. Yeah, they don't want to give it to you. It's very hard to get. It's I had to literally kind of try to find. It's very hard to find studies on it, and I had to try to find studies and convince I had one gynecologist that was following me for the the high-risk pregnancy, she's like, okay, enough is enough now. And she said, okay, we're giving you Permetrium. It's like, it was, for them, it had to be the end of the rope before they would prescribe it to me. And that's what was helping. So I don't understand why it took them so long to prescribe it.
I just want to show viewers, because we doctors are not GOD. GOD is up here. Doctors are right here, right?
Yeah.
And for some reason, we think that we know more. I had never been pregnant, you know, and hell, I don't know. I'm scared of having that thing come out through my hole. You know, I think, oh my God, you know, I would never, ever tell a woman, I know how you feel. You can't. You know, the closest I ever been to a woman saying, what's the pain, is when they tell me, well, Eric, I had a kidney stone. I also had a baby. And I asked them, what is worse? And they had to think about it. The kidney stone must be awful, you know, but I don't know. I had never had kidney stone, but I see men have kidney stone. But a woman tell me having a baby is worse pain than the good thing about having a baby, you have a baby. The kidney stone, you have a big stone coming out of there, and you don't feel good. But I want to add something else. When I say Angie was a robot, when I sent Angie what she needed to eat, every day Angie sent me a text with her menu. It was Angie doesn't know this. I save her menu, Danny, and I pass it to patients. I took pictures. I eliminated her name, you know, out of there. I said, listen, you need to eat this way. Angie, I have three pictures of your menu, and that's what I pass to my patients. I say, eat this way. I don't even tell them now. I say, no, I want you eating this way. This is the menu. It's kind of funny because you like to. Woman, actually, Angie's a very rare species. She can cook, guys. Cook. Not many women can cook. And I'm not saying that to be bad, but women now have I'm going to go buy something fast food, which is not good. But Angie can cook. So some of my patients look at her menu. Oh, crap, I got to cook. I say, no shit, no wonder.
Why do you think I married her? I'm Italian. I can't do what someone who can't cook.
No, but you know, honestly, I would say 60% of my population doesn't cook. They either have somebody buying it for them, or they have somebody making it for them, or you know, their husband cooks or something. It's crazy how things have changed. So that is awesome. Any questions?
Any message you want to leave for the women watching this video, or
anything you want to say? What did you learn from
messages? Well, what did I?
Don't ever get pregnant, ever.
For any of the women.
You didn't tell me. I don't know if I can go through this.
Yeah. For any of the women, I mean, if you're feeling at all not yourself, and you know, you just think, oh, it's because I'm just tired or whatever, and you know, I'll get over it, I'll pull through it or whatever like that. Just anything, like you're just anxious, you're not feeling well, you're crying. You know, it's not always normal. I mean, it's not always normal to just cry. It is normal to want to cry sometimes after you give birth because of your hormones, but it's not always normal to think that you're not good enough to take care of your baby, or to be anxious, or to always be depressed. And many women go through this. And so just, you know, seek out the help. And you don't have to go through that. You don't have to suffer through it. That's the thing. You know, you can fix it. There's ways to fix it.
I want to say something that Angie said that was super, super important to all the women out there. Angie said, I went to my doctor and I want answers. Angie went with research. Hey, listen, I don't feel good. You see, Angie was providing information, but Angie was also insistent on what she wanted. If she wouldn't done that, even though I was telling her, Angie, go get it, Angie, go get it, they will not give it to her. They refused her to even do it. And like she said, it was at the end that they were going to give me something. Do they offer you SSRIs, Angie, or not?
No, because I was breastfeeding. So that kind of wasn't an option.
Wow, in the United States, they even give it to you.
Yeah. Yeah.
Even breastfeeding.
No, they wouldn't, because I was breastfeeding, which I don't think I would have taken them anyways, because I don't really, I mean, they're great for crutches, but you're still going to have to fix the imbalance afterwards when you remove the crutch.
Also, for women out there, Angie, are you taking progesterone still? When do you stop it, which is very important for them to know? Do you continue the progesterone? Do you stop the thyroid? Do you wean yourself out? All these details that they do not know. Can you please teach me? Tell me.
So the progesterone, I was taking it every day because I recently just started my cycle again. It took like 5 months, almost 6 months to get my cycle back. now that my cycle's back, I'm only going to do progesterone the last 2 weeks of the month. So I'm going to try to mimic the cycle, my natural cycle, as much as possible.
How much are you taking? How much are you taking?
I'm taking 200 milligrams a night.
Okay.
Yeah,
thank you.
That's my dose. As per Angie Nichols, because I think she was saying that only 30 to 40% of it is absorbed. So you want to kind of try to take a higher dose for that.
If you do it intravaginally, the absorption is way higher. If you do it orally, it's not as high. And that's why it works for you, because intravaginally is better. Actually, just some women don't want to do it, but you're correct. And then with the thyroid, what do you do? Can you explain it to us?
So I do, as soon as I get up in the morning, I take a tablet on an empty stomach, and always make sure to wait. If you're like me and you want to have coffee in the morning, wait a good 45 minutes to an hour before you have a coffee, because that decreases the absorption.
Okay.
And then
Which thyroid, Angie? Tell them.
I take a combination of a T3, T4 mix. It's prescribed by my doctor. It's not Synthroid. It's not anything like that. It's on the bottle. It's just T3, T4 mix. Okay. Yeah.
Okay. Here in the States, it's called Thyroid. It's a T4, T3 combination. You can compound it or you can write it. You can write it, whatever. But that's what I wanted you guys to know. Now, were you taking this before your pregnancy? Were your dosage higher?
No, I was not. And well, I did take Prometrium throughout my pregnancy.
Yeah, but you were yes.
But then I had to push for a prescription after I gave birth because they didn't want to continue the prescription. So this is what I'm taking. I don't know if you can see.
Given close, that is, okay, turn around. One capsule. There we go. They can see it now.
Yeah, yep. So that's what I'm taking. And also taking a combination, I'm taking B vitamins, omega-3, magnesium, vitamin D. That's pretty much it. Yeah.
So this is a 5 microgram T3, 20 microgram T4.
Remember what I told you guys? Remember what I told you guys, that I use 5 micrograms. You don't need to go above that. Now, Angie takes it in the morning. You can divide it on 2 dosages. For some mothers out there, because the baby keeps you up, like Angie was being up, she was up all the time. Sometimes I will make them take the thyroid at night. Paradoxically, some women sleep better by taking the thyroid at night. Other women don't, but some people, hey, listen, I changed my thyroid to at night and I sleep like a queen now. And I just want to mention that. Angie takes it in the morning, that's what she wants. She's very wise. She doesn't want to take it with coffee. And actually, research shows that coffee prevents the absorption of thyroid. So Angie, you're correct. Now, I want to say this, and I'm going to get eaten by all the professionals here. One, the reason you want to take an empty stomach is because we doctors want to have a perfect baseline of your thyroid, okay? Perfect. I would say 20% of the population out there cannot take thyroid with food, but the other 80%, you can take it with food. Don't be scared. If you don't have the time or you forgot it, just take it with the food, because it's better to take it than not take it, number one. Two is, the reason I want you to take an empty stomach is because I want to see the perfect levels. But once you're stable and you have 2 or 3 blood tests that says, oh, this is stable, don't worry about it. And you just go ahead, not with coffee, like you said, but if you're going to eat, you forgot to take it that morning, go ahead and take it.
Gotcha. Yeah. Perfect. Thank you so much.
You're welcome. I hope that you guys enjoy the hot-looking chick on the video here. I hope that the information that we provided help you. I'll be sending Danny the paper for Sage 547 so he knows what it is. And if you guys have questions, ask Danny, and Danny hopefully will invite me again to the show.
Of course.
Thank you, Eric.
Thank you, guys. We'll see you guys later.
Whoops.
Go ahead.
Sorry. Thanks. Okay, so I got a little bit of drool on me, but
hey, that's better than
yeah. So to all the women watching, I hope that the information that Eric dished out here will help you out, because it definitely helped out Angie, as you can see. The advice was great. The progesterone, the thyroid, the diet.
I want to add, this was just medical information. This was not a prescription. It was nothing like that. It's just for you guys to learn. There was no medical advice. We were sharing the experience, and that was it.
Exactly. All right. So thank you very much for watching. If you haven't already subscribed to this channel, please do. Just hit the little bell at the bottom. You can subscribe. I'm going to be reaching out to a lot more professionals like Eric for both men and for women, for TRT, for training, for diet, for everything involving fitness. We're going to try to get a lot more content on this channel. And if you got questions, you can look me up on Facebook. My name's Danny Bossa. You can send me a message there. You can visit our Facebook group, TRT and Hormone Optimization. And through there, we can help you get in touch with Eric. Eric is in the Ohio area. So that's about it. Thank you so much for watching. Hope to see you guys soon.